It is true that the market is moving to a value-based care model, and I think that we have unfinished business, frankly, relative to where we were in the encounter-based model. And that unfinished business has to do with solving very specific problems, such as duplicate records in our EHR. Studies show that on average 10% of all medical records in an EHR are duplicates. We have medical identity theft, which is an $84 billion a year problem just in Medicare, Medicaid alone. And then we have payment fraud. Those three problems hold some significant risk in the ability to have confidence in the clinical data, as well as financial risks to the business. So when we talk about medical identity theft, duplicate records, payment fraud, Lenovo is bringing some innovative solutions to the market, ones that we haven't seen yet. So we feel that we are on the leading edge of solving some very serious problems and allowing our clients to move towards a value-based care model with great confidence. So it creates an intelligent, connected healthcare system. That solution is centered on a unique health safety identifier. When you have an identifier such as that, and it involves going through a specific identity proving process, very similar to the challenge that Chimes is presenting to the market on how we solve patient identity. So we have a construct on how we do that in a very effective way. As well, we take that, once we do the identity, we assign a unique health safety identifier to that patient, and we attach that identifier to the medical record. And not only do we attach the identifier to the medical record, we collect a second tier authentication to validate that user each and every time they come into the health system. So it's not just what happens in that health system, it's how that patient actually is allowed to bring their identity, their identifier, across the continuum of care with all health systems that support this solution construct. And hence, at the end of the day, we have one patient, one identifier, one record, and that solves medical identity theft, duplicate records, and payment fraud. So it is a solution in and of itself, and at the end of the day, it has a significant return on investment. When you move towards a deterministic matching algorithm on matching patient records, you then consolidate and establish one record per patient. And when you do that, you increase the confidence of the data, and you improve your clinical decision supporting efforts, and then you ultimately can reduce a number of tests and a number of other different costs associated with, again, medical identity theft, the duplicate records, and payment fraud. So not only do we improve the clinical side of the equation, we improve the financial side of the equation. And again, value-based care, we have to do two things. We have to improve the clinical outcomes, and we have to mitigate our risk. And this particular solution, interesting enough, these are long-standing problems that we're solving, but the ramifications of solving them in a very simplistic manner allows us to achieve both of those objectives and allows the market to move forward. So where is this deployed? This is deployed, so this is new technology. And we do have several customers that have not only embraced the technology in and of itself, but they leveraged it to establish a loyalty program. So when you establish the identity, the identifier, we couple that second factor authentication we refer to as a token. A token could be a smart card, it could be a credit card, it could be just an ID card of the health system. So the health systems that we've deployed actually have created loyalty programs around it, so that they actually know the patients as they come in, and they build loyalty programs. So where have we done this? We've done it at several healthcare institutions in the U.S. We're working with 120 some hospitals over in China to do the deployment there, and we're working with other countries. We haven't signed the documents yet, but I can tell you that we're working on a countrywide basis to deploy this across countries. So we're very excited about this opportunity, and we look at the United States as, you know, it's not just what one health system does and being able to carry your identifier across one health system. It's about the patient who has the identifier, and they can take it no matter where they go. As long as that healthcare system is on the exchange, they can take their identity with them. I use myself as an example, coming from New Jersey, going to hospital systems locally, hospital systems in New York City, hospital systems in Philadelphia, and I do a lot of travel to Florida. So, you know, my network of care is much different than any single institution. So I bring my identity with me, and I can have confidence that my records are secure. So we look at this platform. If you look at value-based care, and we look at what where the trends are moving towards. So we have the identifier for the patient, and the healthcare systems are building loyalty programs around that identifier, literally a card that acts as a token, which is a second form of second factor authentication relative to the unique health safety identifier. So now that we have healthcare systems building loyalty programs around the identifier, then we see on the financial side of the equations, we see out-of-pocket payments from a consumer is going to rise from $824 million now to close to $2 trillion by the year 2020. That's not far away. So that means there's going to be an escalation and a significant difference in out-of-pocket expenditures, and therefore, how do we merge, leveraging the identifier, how do we merge the financial side of the equation and the clinical side of the equation? So patient portals today, as an example, only have data for that one hospital or that one health system, that one clinic. They don't have the ability to merge their data, and they don't have the ability to have a financial view, a consolidated view of their financials. We see the mere fact that we have an identifier, we can actually merge those two in a very effective way, and have that patient be a very collaborative part of the patient-centered care model with their care team, regardless of the geography in which that care team is located.